This Docs on Call is brought to you by Excellus, Blue Cross Blue Shield, and Guthrie. I'm here with Dr. Ashok Shah, Medical Director of the Echocardiography Lab with Guthrie's Cardiac and Vascular Center, and we're going to talk about evaluating chest pain. So, Dr. Shah, when people experience chest pain, heart attack is often the first thing that comes to mind. So, what are some of the causes of chest pain, and when should someone be concerned?
Sure. The chest pain could be cardiac or non-cardiac. Most common cardiac cause of the chest pain is angina pectoris, which is caused by the blockages in the arteries of the heart. Pericarditis is less frequent, and it is caused by the inflammation of the covering of the heart called pericardium. Aortic stenosis and sometimes dissection of aorta can also cause the chest pain from cardiac causes. There are several non-cardiac causes of chest pain. Musculoskeletal costochondritis are seen quite commonly in our practice. The gastric reflux is clinically difficult to distinguish from the cardiac cause, and sometimes that mimics the chest pain.
So how do you evaluate patients that may have chest pain related to a cardiac issue? And so what are some of the more common cardiac concerns that you're checking for?
The good history and physical are cardinal to diagnosis any symptoms, and especially chest pain. Once we have done that, then we do the blood test, EKG, cardiograms, chemical and exercise stress test to determine the likelihood of cardiac cause. And it is most worrisome because it can lead to the damage to the heart and cause pump failure or arrhythmias leading to death.
And if you're concerned that there is a cardiac related problem, how do you diagnose and treat that?
So as I discussed earlier, that we could do those EKG and stress tests and like that, and then the final test is the cardiac catheterization, where we find the blockage, and if we find the blockage, we put a stent, what we call as revascularization. Sometimes we are not able to put a stent, then we have to suggest the open heart surgery or the bypass surgery.
Some great information. Thank you, Dr. Ashok Shah with Guthrie. Now, if you want to learn more about the advanced diagnostics and procedures available at Guthrie, visit their website, guthrie.org. You can also go to our website, WBNG.com. If you want to leave a comment or ask a question, call 584-7362, 584-7-DOC.